So this is my head to toe assessment. My name is Megan Abad, Megan Abad. So I'm going to be doing a scan of the room. Okay. Okay. So I'm going to start off by wiping my stethoscope and performing hand hygiene. So hello, my name is Megan, and I'll be your student nurse for today. Is it okay if I perform the head to toe assessment on you?
Yes.
Okay, so I'm going to close the curtain for privacy. And do you have to use the bathroom before we begin?
No.
Okay, so first I'll start off with the physical appearance. So can you please state your name and age?
My name is Rachel Abad. I'm 14 years old.
Okay, so the client appears her stated age, and her skin color is of even skin tone. So for the body structure, can you please stand up for me? So it is symmetrical. The height and stature is within normal range for her background. There's no physical deformities, and the posture is standing. You can please take a seat. So for the behavior, the client maintains eye contact. Her facial expression is serious. The hygiene is clean and well groomed, and the dress is appropriate to the climate. So now for mobility, can you please stand up and just walk towards there and back, please? Okay, you can take a seat. So the gait is smooth, well coordinated, and well balanced, and the mobility is an active range of motion. So for the works of breathing, the client experiences no distress and no signs of distress, and it is effortless. So for the level of consciousness, do you know where you are right now?
A hospital.
Okay, and do you know what day it is?
March 29, 2019.
Okay, and the client is alert and oriented. So now for the head, I'm going to inspect and palpate the head. So it is a normal cephalic skull. It is smooth, it is symmetrical, it is round, and there's no bumps, lumps, tenderness. Do you feel any pain?
No.
And there's no tenderness and no deformities. So now I'm going to be inspecting and palpating the hair. So it is of a brown or almost black color, and the texture is thick and evenly distributed. And now I'm going to be inspecting the facial structures. So it is symmetrical, there's no involuntary tics or movements, the skin color is even, there is no swelling, no edema, no lesions or scars. And I'll be testing cranial nerve number 7, which is the facial nerve. So can you smile for me, please? Show your teeth, frown, lift your eyebrows, close your eyes tightly, and puff out your cheeks. So all facial structures are symmetrical. Now I'll move on to the eyes. So the eyelids and the eyebrows are symmetrical. It's an even lash distribution. The eye color is brown. There's no lid lag or discharge. And now I'll be testing cranial nerve number 3, which is the ocular motor nerve. So for Perla, the pupils are 3 millimeters. And it is equal, round, and symmetrical. I'll be testing the direct and consensual light reflex. So both pupils constricted, and for accommodation, can you stare at the wall for me, please? And then can you stare at my finger? Okay, great. The pupils constricted and converged. So now on to the ears. They're symmetrical bilaterally. There's no discharge. And I'll be palpating the auricle and tragus for any pain or tenderness. Is there any pain?
No.
So there's no pain or tenderness. Now I'll be conducting the whisper test. So I'm going to whisper 3 words in each of your ear. And can you repeat after me, please?
Apple.
Orange.
Orange. Banana.
Flower.
Flower. Laundry. Hanger.
Okay. So words were heard bilaterally. And now I'll move on to the nose. So the nose is midline and there's no discharge, and I'll be palpating the frontal and maxillary sinuses. So do you feel any pain?
No.
So there's no pain or tenderness, and there was only mild pressure. And now to the mouth. So I'm going to be inspecting the mouth. So the lips are pink and are symmetrical. Can you open your mouth, please? And stick out your tongue. Okay. Oh, sorry. And so the gums are pink and there is no swelling. You can close your mouth. Oh, sorry, open it. Okay, and the teeth are present with a presence of repairs, which are braces. And can you stick out your tongue for me, please? Okay, so the tongue is midline, symmetrical, and hydrated. And the soft and hard palate are intact without any lesions. So now I will be testing for cranial nerve number 9 and 10, which is the glossopharyngeal and the vagus nerve. So can you please stick out your tongue and say ah for me? So the uvula and the soft palate rises when the client says ah, and I'll be testing cranial nerve number 12, which is the hypoglossal nerve. Can you please stick out your tongue for me? Okay, can you move it side to side? And can you say light, tight, dynamite?
Light, tight, dynamite.
And there is no tremors. Now move on to the neck. So the neck, it is in an erect and midline position. It is symmetrical. The color matches the face. There is no scars, lesions. And do you feel any pain?
No.
And there's no pain or tenderness. So now I'll be palpating the carotid arteries. Okay, so it is a regular rhythm with a grade strength of +2, and it is symmetrical. Now I'll be testing cranial nerve number 11, which is the spinal nerve, spinal accessory nerve. So I'm going to be applying pressure to your face, and can you turn your face to the left for me, please? And then to the right. Okay, and could you lift your shoulders? Okay, so it is strong and equally bilaterally. So now onto the upper extremities. So it is symmetrical. There's no involuntary movements, there's no swelling, and there is no lesions. And now I'm going to be palpating it. So it is a warm temperature. There's no masses, no edema. And did you feel any pain? No? Okay, so there's no pain or tenderness. Now I'm going to be inspecting the nail beds. So the nails are smooth and rounded edges with a pink nail underbed and a translucent color. So now I'll be testing the active range of motion. So can you just follow what I do, please? So this is flexion and extension of the fingers, and this is flexion of the wrist and extension of the wrist, and this is radial deviation and ulnar deviation. Okay, and this is flexion of the elbows and then extension of the elbows. Then this is pronation and supination of the elbows. And now for the shoulders, can you shrug, please? Okay, and this is abduction and adduction. Okay, and this is internal rotation, and this is external rotation. Okay, so it is an active range of motion with full mobility of each joint. Now I'll be palpating the radial pulses, so can you just hold out your hands like this? Thank you. Okay, it is symmetrical with a regular rhythm and with a grade of +2, and I'll be testing the grip strength. So can you just grip onto my fingers, please? Okay, so the grip is strong and symmetrical bilaterally. Now onto the lower extremities. So it is symmetrical. There are no involuntary movements, there are no physical deformities, and there is no swelling, lesions, or scars. Now I'm going to be palpating it. So it is a warm temperature. There is no edema or masses, and the texture just feels a little bit bumpy due to the clothing. And now I'm going to be palpating the pulses. So can you please lie down? Okay, thank you. So in here would be the posterior tibialis pulse. And here would be the dorsalis pedis pulse. Okay, both have a grade strength of +2, regular rhythm, and it is symmetrical. So I'll be testing the flexion of the foot now. Can you flex your foot downwards for me, please? So that would be plantar flexion. And can you flex your foot upwards, please? And that would be dorsiflexion. And can you flex your foot downwards? Okay, and upwards. So it is both symmetrically bilaterally and strong. So now I'll be moving on to the thorax. So can you please take a seat? Okay. Okay, so I'm just going to move your hair to the side. So now I'm going to be inspecting the posterior thorax. So it is symmetrical, it's an even color, the skeletal, there's no skeletal deformities, and the ribs are facing downwards. Now I'm going to be doing the ratio. So the anterior to posterior to transverse ratio is 1 to 2. And now I'm going to be palpating the posterior thorax. So it is a warm temperature. There is no lesions, there's no edema, there's no masses. And do you feel any pain?
No.
Okay, and there's no pain or tenderness. Now I'm going to be auscultating the posterior thorax. So can you inhale and exhale deeply for me, please? So I would be listening for the normal or any abnormal breath sounds in the bronchovesicular and vesicular area. So there is no abnormal or any, so there's no any abnormal breath sounds. And now I'm going to be auscultating the anterior thorax. Okay. So can you please inhale and exhale deeply for me, please? So it is a regular rhythm with normal relaxed breathing. And there is no abnormal sounds, and all sounds are normal. So now I'll be doing the cardiovascular for the thorax. So I'm going to be auscultating and naming the valves. So 1, 2. So the aortic valve is in the second intercostal space, right sternal border. Then the pulmonic valve is in the second intercostal space, left sternal border. Then Erb's point would be in the third intercostal space, left sternal border. And then the tricuspid valve would be in the fourth or fifth intercostal space, left sternal border. And the mitral valve would be in the fifth intercostal space, left midclavicular line. So the apex would be best, so the S1 sounds would be best heard at the apex of the heart, and the S2 sound would be best heard at the base. Okay, now I'll be auscultating the heart. Okay, so the rate is 80 beats per minute. There's no extra heart sounds, and it is a regular breathing rate. So now I'm going to do the abdomen. So can you please lie down for me? Okay, so I'm going to be draping the client. Okay, I'm just gonna lift the shirt up. Thank you. So for the abdomen is symmetrical. The contour is rounded. The umbilicus is midline and inverted. The hair distribution is normal. The patient's demeanor is relaxed, and there's no scars or lesions. So now I'm going to be auscultating the abdomen, starting with the right lower quadrant, then up to the right upper quadrant, then the left upper quadrant, then the left lower quadrant. Okay, so all bowel sounds are present and normal. Now I'll be palpating 2 or 3 times in each of the quadrants. So starting with the right lower quadrant, then the right upper quadrant, then the left upper quadrant, and the left lower quadrant. So there was no superficial masses, and did you feel any pain or tenderness?
No.
Okay, nope, and now I'll be palpating the bladder. Do you feel any pain or tenderness?
No.
Okay, so there's no pain or tenderness, and that concludes our head to toe assessment. Thank you.